All right, everybody, so welcome back. This is going to be our continuation of our eye dissection. So if you recall in the last video, if you haven't watched the last video, go and watch that first. But here we're looking at a sheep's eye, which again is a good model, a good representation of our human eye. And we looked at most of the external anatomy of the eye, including some of the muscles. We talked about some of the layers. So we talked about the sclera, the cornea. We talked about pupil and iris. And then we ended by talking about the optic nerve, right? So we ended by talking about our optic nerve right here, right? So what we're going to do now is we're going to explore the internal components of the eye. And so you notice here, I've made a cut, right? Kind of dividing the eye into an anterior and a posterior. So I've made this cut in the coronal section of the eye, right? And what we're going to do is we're going to peel this cut open just a little bit, and we'll begin to see some of the internal components of the eye, right? So first off, you may see a few things. One thing that you're surely noticing and surely seeing is this big kind of gelatinous material here, right? So this gelatinous material that you see here, this is something called the vitreous humor. Sometimes it's called the vitreous body, right? And what it is, it's this kind of thick gelatinous substance, right? So hopefully you can appreciate this. It's kind of the consistency of Jell-O in this preserved specimen. And what it's doing is it's doing a few things. One, it's helping to keep the structure of the eye, right? Sorry, I'm trying to keep this open. It's helping to maintain and preserve some of the structure of this, what's called the posterior region, or this posterior chamber of the eye, okay? It's also helping to keep this yellow tissue that you see here. So hopefully you can see kind of all of this yellow tissue in here at the tip of my pointer. This is the retina, okay? So we alluded to the retina earlier, but all this yellow tissue, this is all the retina. You can notice you can kind of move it and kind of peel it, and we'll peel it in just a little bit, right? So it's kind of helping keep that pushed up against the back of the eye. And then it's also helping to keep this circular structure that you can kind of see here. Hopefully you can see it at the tip of my pointer here through this gelatinous material. This structure here at the tip of my pointer, this is the lens, okay? So it's also helping to keep the lens pressed up against the eye, right? So what we can do is we can take this vitreous humor and we'll kind of peel it and kind of remove it, okay? And we'll just kind of set it aside for the time being. So it's pretty soft here, so we can just kind of pinch it and peel it and remove it. And you can see it there very nicely, kind of Jell-O-like consistency, right? And again, in this anterior region here, if we're looking anterior here, so again, this is posterior part of the eye, this is anterior, we can see this kind of in this image, it's kind of this yellowy structure here, right? Kind of this yellow-orange structure here. This is our lens, okay? So we still have some vitreous humor kind of in the way a little bit, right? But hopefully you can see this lens, right? Right here at the tip of my pointer, we can kind of peel it and remove it a little bit, and we'll completely take it out of the eye. So if I can get my probe under here, we can completely remove it, okay? So we're working on it here, and we'll just kind of pop it out, okay? We'll just pop it out, right? So we'll set the eye down for a second, and we'll look at our lens, okay? So we still have some vitreous humor kind of adhering to the lens, and again, remember the vitreous humor is kind of pushing on the lens and keeping it pushed up against the eye, keeping it in place. And so this is our lens, okay? So you may have heard of the lens. You can have a lens replacement. So in cadaver dissections that I've done, I've encountered cadavers who have had lens replacements. They have an artificial lens in their eye. And so it's kind of hard to appreciate this, but this is a relatively firm structure right now. Okay, so right now, it's kind of hard to appreciate, but I don't know if you can hear that, but it's relatively hard, okay? It's not solid, but it's relatively hard. It's much harder than it would be in a living individual, okay? So ordinarily, in a living individual, so say in a living human, you have this lens, and it is able to be kind of stretched, and it easily changes shape, okay? And so what this lens is doing is, as light is passing through, we'll set the lens down for a second. As light is passing here through our eye, right? So again, recall This would be our pupil, right? So there would be a hole here, and you can actually see the pupil a little bit easier if we come to this inside view, this internal view. Hopefully you can see that window, right? You can see that little opening, right? That's the pupil, okay? So I'm gonna try to do this with one hand, but you can see the pupil right there, right? You can see that opening right here where my probe is, right? And you would be able to puncture and go all the way through that. I don't know if I'm gonna be able to do it with just one hand here. But that is our pupil, right? And so as light is funneling in through that pupil, it is being bent, right? The light rays are being bent as it strikes our lens, okay? And then those bent and converging light rays are gonna be focused back here on our retina, right? On this yellow tissue all back in here, right? So if we continue looking at the anterior, the inside view, but looking anterior, if we kind of flip this eye out a little bit, you can see it a little bit easier, okay? So one thing you see, again, is our pupil, right? Here's our nice pupil with the cornea in front. Iris would be off to the side, okay? Now, we also have what's called the ciliary body. And you can kind of see this structure kind of radiating all around the eye, all out here. This is something called the ciliary body, okay? So the ciliary body contains several different things, okay? One thing it's gonna contain is something called ciliary processes, right? And ciliary processes create, they produce and secrete a type of fluid called aqueous humor, okay? And aqueous humor fills this anterior kind of chamber of the eye, right? So remember the vitreous humor, all this gelatinous material, it's in this posterior part of the eye. What's called aqueous humor is more in the anterior part of the eye, okay? If you've ever heard of glaucoma, glaucoma is an increase in the pressure, the intraocular pressure in the eye, and it can be due to a buildup, an excess buildup and accumulation of aqueous humor in this anterior part of the eye. So for some reason, too much is being produced and or it is being inefficiently drained out of the eye, okay? But that's what these ciliary processes produce. Now, in this area, we're not gonna be able to see them in detail, but we have something called zonular fibers, and sometimes they're called suspensory ligaments, right? But they would stretch out from these ciliary processes, and there's muscle here called the ciliary muscle, and it would stretch out and they would attach to our lens, okay? So we'll call our lens, if I can pick this up here, our lens would be sitting kind of in front like this, okay? It'd be sitting in front. And radiating from these ciliary processes over to the lens would be these suspensory ligaments or zonular fibers, right? And what happens is as the ciliary muscle contracts and relaxes, it's going to make these suspensory ligaments either loose or taut, which is just another term for being kind of tightly pulled, right? So they're gonna be loose or they're gonna be taut. And in turn, that is going to change the shape of your lens, okay? So as your lens sits here and that ciliary muscle contracts and relaxes, it's changing the tautness, right? How tight the suspensory ligaments are, the zonular fibers, which in turn is changing the shape of the lens, right? Now, why is this important? Why do you want to do this? Why do you need to do this? Well, this is something called accommodation, okay? And what this is doing is this is allowing for near and distant vision, okay? So it's allowing you to see things at a distance, and it's allowing you to see things up close, okay? And so a round lens, when the lens is more rounded, that is much better for near vision, okay? When the lens is more flat, that is better for distant vision or distance vision, okay? And so what you have happen is the ciliary muscle contracts, which actually moves the muscle closer to the lens. These suspensory ligaments become more loose, and so the lens becomes a little bit more rounded. And then conversely, when the muscle relaxes, it moves away from the lens, it pulls on the suspensory ligaments, and that causes the lens to become a little bit more flat for distance vision, okay? And so you can have errors with this, or you can have problems with this as you age, as the lens becomes less flexible, right? So maybe the lens is more permanently round, right? Because it's not as pliable, it's not as easily flexible, it stays round, and so you have difficulty seeing things at certain distances, right? And so these are changes that can occur as we age, right? But just as a review, right? Again, pupil here, lens here, which again would be sitting kind of in front. It's being held in place by that vitreous body or humor. You have our ciliary body. There are ciliary processes that come off of those, and extending from those are zonular fibers, which radiate and attach to the lens. And again, when that ciliary muscle contracts, pulls on the zonular fibers or suspensory ligaments, changes the shape of the lens, allows for either distance or near vision, right? So we'll stop here. We'll pick up with our next part, and we'll turn our attention more so to this back part of the eye, all back here, and we'll wrap up there.